Hello, I'm Gunargie O'Sullivan. We have Trey, who's in the house with us at the Carnegie Center. He is responsible for the people on a street level, keeping us alive. He's going to show us how to use this kit right here. Pay attention. Take it away, Trey.
Thanks for having me as your guest here. I'd like to acknowledge that we are on the unceded West Coast Salish and Tsleil-Waututh nations, and I am a settler on this land, and I'm grateful to be here. So
Thank you.
what we're going to talk about is we're going to talk about some naloxone training here. I got Corwin with me. We work at OPS, and OPS is the Overdose Prevention Society, located at 58 East Hastings. And we are a peer-run site, so we're an emergency response to the opiate crisis that we're still in. So we are a peer-run site, which means that we hire people from the community. So we work with lots of different community members and help them with whatever they may need. But most importantly, our primary purpose is to make sure that no one dies from an overdose of substances. So today we're going to talk about naloxone training, and I'm gonna, hopefully when we walk out of here, you guys will feel confident enough to know how to use one of these. Okay. I highly recommend, if you're in the Downtown Eastside, having a naloxone kit with you at all times. You would probably not be surprised how many overdoses I've had to deal with on my lunch break.
Tell us, give us a number.
A lot.
A lot.
A lot. I don't keep count anymore, but I can tell you that I've had to deal with overdoses right here in this building at Carnegie. So I come here for breakfast, lunch, and dinner, yeah, I've had to deal with a lot of ODs within the bathroom and everywhere.
And just in between one block to another, we can see people who have keeled over. We have to check to make sure they're still breathing, and it's ongoing. So show us how it's done. What would happen, say for instance, if our friend here was ODing?
Corwin?
Yeah, how would you be able to tell this dude is ODing?
First I asked him, Corwin, are you ODing? He's not answering. Next thing I would do is I'd kind of ask the person. I'd go for claps.
You would ask them to clap?
No, I wouldn't ask. I'd be like, hey, can you clap for me, Corwin?
Yeah.
He's not clapping.
Yeah.
He might be ODing.
Yeah.
If I verbally tell them that I'm here and try to make loud noises and they don't answer, I would then go for a visual. So I'd want to look at Corwin here and make sure that he's still breathing.
Yeah.
If his chest is moving, taking breaths, I'd probably just leave him alone. I might not even wake him up.
Because you don't want to kill their high either.
Right, yeah. If you don't have to use a naloxone kit and you don't want to naloxone them, at OPS we try not to, right? This is the most important thing to remember about naloxone is that it's not like a magic bullet.
Yeah.
It may or may not reverse your overdose. And the most important thing is actually oxygen.
Okay.
Oxygen. So a lot of street side overdoses that I've seen in the Downtown Eastside and helped or just witnessed going by, and then someone else is handling it just fine, they don't need my help. Quite frequently they're not giving the person oxygen. They think that if they just jam them with a shot of naloxone over and over and over and over again, they're just gonna wake up and start walking around again. So yeah, I've seen that quite frequently, around 8 people standing around a person who's overdosed, and they've jammed them with 3 kits, and they're why are they still blue? Why are they still blue? Why aren't they waking up? It's because they've been deprived of oxygen, and the most important thing is oxygen. Okay. So
one of these guys here.
yeah.
Okay.
At OPS we use these. These are called oximeters. So you just slip it on your finger and press the button, turn it on.
Here, I got a finger.
All right. So, and it'll give you a reading of what the oxygen level is. SpO2, oxygen level is 97, and beats per minute is 90. So
is that good?
Yeah, that's really good.
Am I still alive?
You're still alive. Yeah.
Still kicking.
So if the oxygen saturation is below 90, that's bad. So it could be an overdose, or they could be deprived of oxygen. The beats per minute depend on the person and like whether they're male or female or what age rate or possibly even what they've used. If they've used like a stimulant, their heartbeat could be going quite fast. So what I have here usually when I do naloxone training is I have a little cheat sheet here. This is the overdose survival guide. So it's got lots of information in there about what an OD may look like, which is some of the things we've gone through.
A person who is on opioids or a depressant, they can't talk or walk. So they're kind of like nodding out, right? Can be shocking.
Yeah, easier said than done, trying to stay calm in an OD. Like usually it's a very panic situation, and depending on what you're dealing with, you could be like dealing with like a violent assault happening at the same time during the OD or like, you know, various things, lots of various things. Maybe they OD'd and they're a street person and they have a dog and the dog thinks you're trying to hurt their owner when you're just trying to revive them, the dog. So you always want to be careful about like the situation and take like a little, like just kind of look around and make sure that you're safe before you jump into any kind of situation, right? Okay. When you're dealing with like a street side OD, like I'll just give you guys like a basic scenario. Like I encourage everyone that may be watching this or like around to get your standard level first aid. It's a pretty basic course. I think it's like $160, and it's good for 2 years. So in the standard level first aid course, they would like give you like scenarios. Naloxone training is separate from like standard level first aid, but first aid helps you prepare for like identifying whether it could be like a fall accident where like maybe the person could have like a damaged spine. You may not want to touch them in that situation, or as opposed to like an OD. If you're in the Downtown Eastside and it looks like they're unresponsive and on the ground, it's probably an OD, but it's always best to like, proceed with caution, right? Okay. So let's just make a scenario here. I'll give you guys a scenario that I've actually dealt with. And then I'll get you guys to help me. So here's our overdose victim. You can see the eyes kind of rolled into the back of the head, and he's got little pinned pupils, and he doesn't have a lot of teeth left, but his tongue's sticking out there, and he's blue. So that's one of the signs of an OD is they're blue.
And he's limp too, right? You see, because it's all limp.
So Gunargie, we're gonna say that you are walking down the alleyway between the Army and Navy and Cordova, like that alleyway there on the West Hastings block, this West Hastings 0 block. Okay. And as you're coming down the alleyway, you see a man, and he's, let's just pretend this glove is a man, and he's face down in the middle of the alleyway. Okay. So what's the first thing you want to do?
Excuse me, sir, are you okay? Hello? Are you all right? Are you breathing? I don't think I'm not sure. I think he might need some help.
Yeah. So
he's not answering.
Maybe try not touching him first.
Yeah.
I'm sorry.
Just say something to him first before you.
Okay, don't be touching him.
Don't be touching people right away, because sometimes they freak out. And you never know what kind of trauma a person may have, so like maybe they have issues with people touching them. You want to just walk up and kind of look and make like a danger assessment, make sure that there's no one like hiding behind a dumpster that's going to come out and thump you or something, or there's a dog attached to a shopping cart behind the dumpster that you can't see that's going to come out and run out and try to protect its owner. Like who knows, right? There's all sorts of crazy things that can happen. So we come up and we see this guy, he's face down. We just want to like give a verbal, just say, hey man, are you okay? Hey, I'm just out here, just you know, enjoying the night, and I just want to make sure you're okay. So he doesn't give us a response. So we would move in closer, and we see that he's blue. He's got the telltale signs of an overdose, of being deprived of oxygen. And let's pretend that he's bleeding from his head profusely. So what would you want to do then, Gunargie?
Well, I didn't get a response from him. He's got the blue hands. He's got some blood going on there. I think I'm going to run to Overdose Prevention Site, and I'm going to call 911
there you
at
go.
the same time.
You're going to want to call 911. Always have one of these when you're in the neighborhood. Please carry one with you. It's better to have one and not need it than like need it and not have it. So we see that he's blue, we see that he's not breathing, we've assessed that it's an OD. So the very first thing we want to do is we want to call 911. So even if you aren't sure, there's nothing wrong with having paramedics come to the scene to check it out, because you can always call 911 back and cancel it and just say, hey, you know what, it's okay, this is dealt with, right? So your standard 911 phone call will look like, you'll dial 911 and it'll say, hello, 911 operator, do you need police, fire, or ambulance? You would say ambulance, I think I'm dealing with a possible overdose. So they would say, please hold for BC paramedics. Now, one thing that's happened to me twice actually, which is quite scary, when you call 911 and they transfer you to BC ambulance, they may be busy. Like all the BC paramedics might be busy right there, so they might be like, please wait on hold. So it's an emergency situation, your blood's going, you're hyped up, and just stay on the line, right? Yeah. The best thing to do, if you got your phone and it's just you responding to this OD by yourself, is just to put your phone on speakerphone, and then go ahead and start dealing with the OD. So in the Downtown Eastside, there's these giant alleyway markers. They're like about 12 feet high on the poles in the alleyways, and they're like Daglow green, like fluorescent, and they say where you are. So these were created. These were created specifically for the Downtown Eastside because so many people have passed from emergency situations and they couldn't find out where they were. Like, you know, you're in the alleyway and you do a smash of your dope or whatever with your loved one or your friend, and then you wake up and then you find your friend's OD'd and you don't know where you are. So you waste those valuable seconds, like after if you even got a phone, like running out to the street to try and identify where you are geographically and then run back to assess the situation. So they're in a very like just the 3 block, like the zone, like ground zero kind of area.
So we're waiting for the ambulance to show up, but they're kind of busy, and this person is slowly, dead fastly fading away.
So you've told them where you are. So the alleyway marker where you are behind Army and Navy there is 45 West Hastings. So you would tell the BC paramedics that I'm at 45 West Hastings, and you have to say lane. It's very important that you say lane because lane identifies that you're in the alleyway. So so you tell them where you are. Next thing you're going to do is you're going to open your kit. So you open up your kit here, and first thing you're going to want to take out in this scenario, because this guy's bleeding, is you're going to want to put on your gloves. So the gloves are, because you know there's like nasty stuff when people are bleeding, or maybe they've puked everywhere, right? You just want to put on the gloves for protection.
For their protection too, because if they have an open wound and you're all like dirty, you know, you don't want to infect them either, so it's good. Protects both people.
So put on the gloves, and right now we're talking to an operator, and we're telling the operator that we're going ahead to proceed with our Naloxone Kit and giving respiratory breaths. So once we've got our gloves on, we're gonna turn this person around. So we have to roll them over gently.
Gently, I'll do that.
Okay.
Okay, I'm gonna touch you now. All right, there you go. Oops, there.
Great job.
Okay, thank you.
So you always want to make sure that the head is supported when you roll the person over. You don't want to smash their head around into the concrete. And when you roll the person over, be careful about needle stick injuries. So quite frequently with ODs, and like because the dope is so strong, today, like sometimes people don't even get their full hit like out of their arm. Like they'll still have like a needle. They did half their shot. They didn't even get the plunger all the way down before they dropped dead. So when you roll this guy over, I'm gonna say that when he rolls over, his arm comes out and there's a needle sticking in his arm still.
Okay.
So just be careful that like the needle doesn't pop out or anything, and like and roll onto his body in case you had to do like CPR or something. You don't want to like put your hand on the needle. So I would just say like just carefully give the guy a hand, pull the needle out of his arm, and I would just toss it away from you, like throw it away behind a dumpster, just until the emergency situation is dealt with. I want to quickly talk about needle stick injuries in case you are poked by a needle. A lot of people are afraid of getting like AIDS from a needle, the chances of actually getting like HIV or AIDS from a needle are like winning a lottery. It's very, very low. Usually the virus will die the second it hits the air. So the chances of actually getting AIDS or HIV through a blood-infected needle is very, very low. If you do get pricked by a needle, I would say don't squeeze it. Needle stick injury protocol is not to squeeze it. That would be my first instinct, is like squeeze the blood out, but don't squeeze it. Wash it with warm soapy water and go to St. Paul's Hospital. If you are concerned that like if the situation is where maybe the person had HIV and they can tell you that they have HIV and you were pricked with the needle directly after it coming out of their blood, they can give you the anti-HIV virals. So you want to get to St. Paul's within 48 to 72 hours, and they'll give you a 5-day cycle.
Wow. You don't think of stuff like that, you know?
So it is pretty strong. If you want to just have peace of mind, you can take them. They're like dropping a nuclear bomb in your body. You're pretty sick. I've had to take them 3 separate times. They suck, but
That's quite the sacrifice you're making there, Trey.
yeah, if you're worried about it, you can take them. The other thing about if needle stick injury, if it's like Hep C, there's 6 different strains of hepatitis C. With Hep C, if you think that there's hepatitis C in the needle, Hep C can live outside in the air for up to 30 days. And you don't have hepatitis C, you go to the hospital or tell your general practitioner that you had a needle stick injury, and they would test every 3 months, test your blood to see if it shows up. If it does show up, you can go to the infectious disease doctor over on Burrard and Drake, and they'll give you the Hep C remedy, which I think is called Eclusa. I just took it last year. I had Hep C and I got zapped. So we're pretty fortunate that we live in Canada and that Medicare is covered, right? So it's like a $72,000 treatment. It was like just covered. So I'm pretty stoked about that I got my Hep C cured. Back to what we're doing here. So we roll him over, we pull the needle out of his arm, we throw it behind a dumpster for the situation. 911 is on the phone, so 911 operators are telling us to go ahead with giving respiratory breaths. So inside your Naloxone Kit, you will have face barrier shield. So this is to protect you from any bloodborne pathogens. This guy's bleeding from the forehead.
Okay, so we've opened this up.
So open this up, and it's got the instructions on the front there. So what we want to do is we've rolled this person flat on their back, and it's got the instructions on the head tilt. So we're going to tilt their head ever so slightly, just so that the jaw is pointed upward. So if you imagine me like flat on my back, just turn my head like that so that it's a clear airway, so the head is slightly tilted. You wouldn't want to put anything under their head, just because it would give a weird angle. But we just want his head slightly tilted. So I was told to kind of like put these 2 fingers, my index finger and my middle finger and my thumbs kind of behind the ears, and just ever so slightly turn the head up, like that.
Would make sense, right?
Yeah.
Okay,
This little piece here goes in their mouth. So we're gonna just, sometimes with fentanyl, it causes rigidity. Their jaws could be locked. If you can't get their mouth open to put this little mouthpiece in there, you can massage their jaw. Or you could use one of the vanishing point syringes to pry their mouth open.
Oh, that's a good idea.
Once you get their mouth open, just take a little visual inspection and make sure that there's no needle cap in there. There's no false teeth that came loose. If false teeth came loose, just take them out and put them on the ground beside them. We want to make sure there's no obstruction. If they're vomiting, we want to actually roll them back onto their side and scoop the vomit out of their mouth, and then roll them back into the flat position. Yeah, a lot of people asphyxiate on their vomit. So we see that this guy doesn't have any puke in his mouth. There's no obstruction in his mouth, so we're gonna stick this mouthpiece right in his mouth there. And we're gonna plug his nose and give him a breath every 5 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. So if it was like plugging his nose and then 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. So the next thing we would do is in between breaths is it's pretty hard to do when you're by yourself to get a naloxone shot ready. But you just do the best you can when you're by yourself. So if you end up giving him a breath every 7 seconds or 10 seconds, whatever, just do the best you can. You want to get this prepped as fast as possible. Let's just say in this scenario that as you're giving this person rescue breaths, remember oxygen is more important than naloxone, right? As you're giving this person rescue breaths, someone at the end of the alley sees you kneeling over a person in the middle of the alley and comes running up. And they say, hey, do you need any assistance? And you say, yeah. Can you prep this naloxone shot for me while I give rescue breaths? So they say, I don't know how to prep a naloxone shot. Yeah. So you say, okay, I need you to kneel down here and give this person, plug their nose and give them a breath every 5 seconds while I prep a naloxone shot. So now we're gonna prep a naloxone shot. Right. So there's your syringe. You got one ready?
My gloves
already.
are still on.
Oh, through the magic of TV.
Do you think it's important to like change your gloves if they're dirty, like at this point?
No.
No, you don't have time, right? You just gotta go for the. Okay, so that's open now. Here's my needle.
You should have a little pill container with 3 ampules of naloxone. So here's one for you. I already got one out.
Okay, thank you.
These little rubber stoppers on the ampules are to protect your fingers from glass breakage. So you just want to leave the rubber on there. Okay. And then as best you can, kind of swirl it like that to get all the liquid into the bottom of the ampule. Once we've done that, we'll just hold it in our less dominant hand and on a slight angle like this, just go like that, and it should just pop right off.
So what am I popping off?
Just like hold it like this, and you're gonna break this.
Oh my goodness,
break that off.
Really?
Yeah. There you go.
Oh wow, I did it.
Nice.
That was scary.
So you guys want to see it again with the camera? Here, just you want to hold it like that, and then just breaks like that. It's already scored and ready to go.
Okay.
So now we're going to take our vanishing point syringe. Open your syringe up.
Okay, it's open.
And uncap it and just stick the needle tip as best you can into the ampule.
It's called an ampule.
Yeah. Just hold it as best you can with one hand. Hold the ampule, and then pull up on the plunger. Yeah.
And what if there's all that air in there?
That's okay. We'll get rid of the air.
Okay.
So there will be air in the syringe. That's okay. We'll get rid of it after.
It takes quite a bit of air to
Yeah.
Can you tell
That's
I'm
great.
an amateur?
You got it, Gunargie.
Good.
You already got it.
I'm good.
That's good.
Okay.
So now pull the syringe out of the ampule.
All right.
Yeah. Turn it right side up so the needle's facing up. And then just expel the air. So you're just going to push the plunger up until the air is expelled.
Dr. G is in the house.
Dr. Gunargie.
Yeah.
So after that, after you get the ampule in there, it should be around the 1 line on the syringe. That's 1 ampule.
Yeah, right there.
Now I'm going to teach you guys a trick here. Hopefully he's still getting, the person that came up is giving him rescue breaths every 5 seconds. I opened 2 ampules here. In every kit, there's 3. If it's an advanced OD where this person has been down for quite some time, you can put 2 ampules in 1 syringe for a total of 0.8. And the reason being is you want to give them a nice strong dose to combat the strong opiate.
So is this known as like up? Is it like?
This is just naloxone. It's a drug that acts as an opiate antagonist, and it
Okay.
attaches to the opiate receptors in the brain and then blocks whatever opiates attached to them.
Okay.
So, and then respiratory will continue from that point. So in mine, I've got 2 ampules in this, so that's a total of 0.8, but Gunargie has just 1.
I just got one.
That's okay. You could start with just 1 to start off, and then you would give a shot every 3 to 5 minutes. If it was a bad OD like this one, and an advanced one, you can start off with 2 to give them a nice strong dose. So just put the cap, always put the cap back on, just in case, like if someone asked you to prep them a needle, you never would want to be like, here you go, and pass them. I've seen it happen.
Yeah.
And here you go. And then they put their hand up and it goes through their hand, and then the needle's contaminated and no good. So always,
What I almost did.
yeah, always put the cap back on just for safety. Once it's ready, at ops, when we have an overdose at ops, we give a naloxone shot through the clothing. So I just would like pinch this person, this guy who's OD'd. I'd pinch his leg ever so gently, just a slight pinch. And I'd go through the clothes. So make sure that there's no like wallet or keys or phone there or whatever. And we're just gonna go through the clothes. So into the thigh. So like media, like movies like Pulp Fiction have like this portrayal of like during an OD stabbing. You don't want to do that because like chances are the angle that you come down on is going to be wrong, and then the needle tip's going to break or bend off and stab you. So don't stab, just like a nice gentle pinch, just a gentle pinch through the clothes. Can you guys see this? Gentle pinch through the clothes all the way in. Once it's in, just push that solution all the way down until you hear pop, and the needle will retract back into the barrel of the syringe.
Wow.
Yeah, where did it go?
Where'd it go?
Yeah,
It's
magic.
called the vanishing point syringe. So,
Vanishing point syringe, write it down.
Gunargie, do you want to give this person some naloxone?
Okay, this will be my first time ever. I'm a naloxone virgin. So here I go. He's flat, and I go, and I don't want to stab him. I just
a light pinch. So pinch the skin first.
okay, pinching the skin first.
Yeah.
And then I'm gonna go in up straight, right? Not sideways.
You can go any way you want.
Okay, there.
Yeah.
And then I'm gonna push it slowly, right?
Yeah.
Not fast, just slow and easy.
So you hear pop.
And I heard it pop. And
No, it didn't pop.
oh, I heard it pop though. Okay, so what happens if I do that? What I just did? Oh, I heard it pop. See, and I even saw.
You got it.
I even saw it pop back up, and it popped out. That's amazing.
Right.
Wow.
Corwin, you want to do it?
Oh, he's gonna be.
Vanishing.
He's going to be full. So, so you want to give a rescue breaths every 5 seconds and a shot of naloxone every 3 to 5 minutes. So this was an advanced OD. I started off giving 2. And even if I give 2 right off the hop, I still want to wait another 5 minutes. I would tell the rescue 911 operator that I gave them a double dose to start because I want to give them a nice strong hit of naloxone to combat the fentanyl. But otherwise, you could start out with just 1 ampule. 1 ampule is okay, too.
So-
Chest compressions too to get
Oh,
that blood
yeah, the
flowing.
chest
And get the blood routing through the system, right?
So CPR is if they've stopped, their heartbeat has stopped. So you always want to make sure that their heart is still beating. So if you don't, like obviously no one on the street would probably have oximeter on them. The best way to check for a heartbeat is actually to just put your index finger and your thumb on the edge of the jawline and slide down towards the Adam's apple about 1.5 inches and just give a light squeeze. And you should be able to feel a heartbeat there, even if it's the, even if,
sides, actually.
yeah, even if it's the faintest heartbeat, you should be able to feel it there. It's a lot more accurate than going for the wrist because sometimes in this cold weather, like the skin is cold and it's hard to get a heartbeat there.
So when that person actually comes out of, this is a successful, like,
Yeah. So quite commonly with ODs on the street or even at ops, when you're giving them rescue breaths, usually like right after we give them this, they'll come around and wake up. So they'll be quite startled.
Yeah.
They won't really remember what happened. And what you really want to do is just advocate to them like, hey, you just overdosed and please don't use any more today. Because the danger with using more after an OD is that the naloxone counteracts the opiate for only a half an hour to 2 hours.
yeah.
So the danger is that if they keep using and they're alone, the naloxone will wear off, the opiate will come back up, and they'll have what they call a post-acute overdose in a dangerous place later on by themselves, where maybe like someone wouldn't find them, like in their apartment. So they really should, if they're willing, go to the hospital where they can be monitored for a bit after that, and just say, don't use any more today.
Quite often I found from a street level that not a lot of people are willing to go to hospitals, especially some feel like St. Paul's, isn't very sensitive towards their needs. Some want to go elsewhere like VGH and things like that, I've noticed too, right? When, in your eyes, what is the best hospital to go to in an emergency situation where they're going to be treated with sensitivity?
The closest hospital, honestly, like, it sucks being like a user and getting stigmatized at, like, in a hospital setting, but like, I have a story that that happened to one of my friends that I always think about, and he was at a party, they were using some dope, he was drinking, so like, some people don't know, I'm just going to say it, using alcohol and an opiate is a very deadly combination. It's very dangerous.
Even Indians know you don't mix your medicine.
Yeah. So I don't know if he was aware of this or he was just drunk and he just wanted something else. But he used some down. That's the street terminology for like an opiate. He used some down and he was drinking and he OD'd at this party. They called an ambulance. Everyone at the party was like, you're not taking our friend. We're responsible. We'll watch him. He doesn't need to go anywhere. So they put him in a back room. Someone said they'd watch him. They ended up kept partying. The naloxone wore off. The opiate came back up, and when they went back in there to check on him in the morning, he was dead. So, like, I tell his story. Rest in peace, Tom. This is my friend Thomas. Hopefully, like, someone doesn't have to die like that, right? Like hopefully Tom's death wasn't in vain. So at least I can share that story, right?
Listen, Trey, this teaching that you have given us is very, very important, and we're doing this to save lives in the urban city. But we all know that the opioid crisis is like all over the map. And we have reservations, like over 196 reservations here in British Columbia that should be taking responsibility for their communities and making themselves aware, bringing people like Trey from the Overdose Prevention Site to your community is really what I recommend to you, so that we can openly save each other's lives and not be blind to what's going on in our community. Don't hide away from it and shy away from it. This will save their lives. So how can we bring you to remote areas and reservations for these teachings?
Well, you can definitely get a hold of me and Sarah Blythe. Sarah Blythe is the executive director. Reach out on Facebook, send me a message. It is set on private, but I will see your message eventually. I should be able, like, if I can't do it myself, I should be able to organize like someone to get out there or close nearby, right? And there's lots of naloxone trainers everywhere, so.
Anything else you'd like to say?
Just be careful. Just be careful, right? Like, this crisis isn't over, and like the dope's still poison out there, and like nobody's bulletproof, right? If you're Indigenous and you got your status card, you can actually get the nasal naloxone spray for free from any pharmacy. I think twice a month. Normally the nasal spray is $180. We don't use it at Ops just because it's expensive.
What's it for?
So the nasal spray, I don't have one with me unfortunately right now, but it's just a little spray thing and you stick it right in the nose, and it's very self-explanatory. Index finger and ring finger, and push the little button in, and it gives a really strong dose up the nasal cavity, and it's just as effective as a intramuscular shot. So yes, if you're Indigenous or a veteran of this country, you can get nasal spray for free from any pharmacy. If you want the syringe package, you can get them from any pharmacy as well, I believe. Those ones are free, but the nasal sprays cost money.
You can also Google where the harm reduction care places are in your neighborhood.
Yeah.
There's a lot of them.
Absolutely.
You wouldn't know they're there, but they're there.
Google harm reduction supplies or nasal or naloxone. Where can I get it within my community? And it should be you should be able to access that, hopefully.
One thing you really gotta watch out for, I've found, is when you walk up on somebody and you find that it's this total stranger, you found that they are ODing. A lot of times people carry weapons, and when you do phone a lot of times they'll mistake you for talking to the police, and
No, they don't like that.
I've seen it happen a few times where people will, they'll go for that knife or they'll go for that whatever they've got, and you really got to make sure that you are safe before anything else.
I know that you've recovered from your addictions to a certain degree. I'm interested in your story.
Well, I do use down.
What does it feel like?
It's unfortunately to say, it is an amazing feeling. It is something that I picked up from past surgeries. I started with OxyContin,
Yeah.
and eventually moved to something stronger and stronger and stronger. And it has completely ruined my life. I gotta say, I've been lucky to find Trey and them, and they've been there for me, and they are pushing to have me help me get past it. I do want to.
Yeah.
I'm not sure what's holding me back at this point. It is causing me health problems at this point.
What kind of health problems?
Well, I've got pneumonia.
Okay.
I've just found out that I've got Hep C,
Yeah.
and that was a complete shock to me. I didn't know that. It is curable, but it is also very, shocking to find out when you do find out that you have it. It's not a happy day.
And so this is where the Overdose Prevention Site can give you support. You're talking about quitting, so they can provide you some harm reductive services and help you to get on that healing journey.
Well, they've been through it, especially Trey. He's been through it. He knows the right places to go. He knows how to fast track it for me. I'm lucky that way.
Yeah.
Not everybody has that.
No.
Well, we need lots of different options for lots of different people is like the bottom line, right? Like there's no clear-cut answer to what someone may need. Like sometimes just like housing is a big issue, right? Sometimes someone could use counseling or trauma care. Sometimes people want to go to detox and it's not even to stop, it's just to take a break, right? Like success looks like lots of different things. Like even just going to detox for like 7 days to chill out and get three meals and a bed and relax is a success, right? There's lots of different levels of success, and we need lots of different answers for lots of different people.
True. Yeah, it just goes to show you how much we take for granted. I would like to say thank you very much, Trey. It's been a pleasure, and it's been nice meeting you, and thank you for being so open with us. You can find them at 58 Hastings Street. Go have a look and see if you can contribute in some way. Maybe you would like to donate some money to the Overdose Prevention Site. Whatever you do what you can. And you can also hit up Trey and Sarah Blake.